Okay, practicing some positions laying on your back. You can either be perfectly flat if you're comfortable and early enough in your pregnancy that you can lay perfectly flat. Otherwise, have yourself raised up a bit with your head above your hips. And all you need is about 30 degrees of lift to be able to offload the viscera in your vascular structures to be more comfortable and be safe. So get a bed wedge or get a bunch of pillows and make an incline for you, and you can practice in this position. So first thing you can do here is just get into a butterfly stretch. Okay, so get your feet together, knees bent, and then just let the knees fall out to the side. Your feet should be touching bottom of the feet together here, and just letting gravity pull your hips open, feeling a nice stretch in the inner thigh area. Again, these inner thigh muscles have connections to the front of the pelvic floor, so stretching the inner thigh should help open up the pelvic floor area a little bit better too. So you can just hang out here and work on that deep breathing again, pulling that deep breath in down through the pelvic floor, feeling it expand and open, and then breathing out and feeling it gently lift back up. And so you can just hang out here, work on your breathing and stretching. You can go in and out here as well if just holding is too uncomfortable. Whatever feels good to you, or a little bit of both. Now you can also start to get into more aggressive hip positions to stretch the pelvic floor as well as the thigh and hip muscles. So you can just get into a knee to chest position, making sure your knees are wide enough to not be pressing on your baby bump. So knees slightly out to the side of your body, and you can just hug in. And you can work on your breathing here, opening up the pelvic floor with that inhale. And then gently lifting as you exhale. You can do a little side to side rocking as well. Play with it. See how it feels, what's comfortable for you. You can kind of go in and out. Whatever feels good to your body. You can try doing little circles, both directions. See if you can just get things a little loosened up and get baby to move into a little bit better position. And then if you want to get into a little bit more of an aggressive stretch position, you can start to get into happy baby position here. So ideally, you're grabbing the insides of your feet or your big toe and pointing the bottoms of your feet up towards the ceiling. And this is a really big stretch on the thigh, inner thigh, the hips, the pelvic floor. And you can work on your breathing here. If this is too aggressive, you can grab at the ankles or even down at the shins, whatever you're comfortable with. Occasionally, I'll have people take a towel and hold their feet that way if they really can't hold with their arms. So you can really practice the happy baby to just open things up. And again, you can do some rocking side to side in happy baby. So you can rock side to side as you're stretching. You can kind of go forward and back. You can move your legs up and down and go in and out of that stretch position. Just play with it and see what your body responds best to. Also, you can just lay here with your legs bent and practice your breathing mechanics. If doing it on a ball or in sitting in a chair or standing is too difficult, practice it here. See if you can pull that breath in down to the pelvic floor with that inhale, and also feeling your back expand. You can feel the sides of your ribs and your lower back, and practice feeling those ribs open and your lower back expanding as you're taking that breath in, making sure that your lower back isn't arching during that breath in. That's not what we're looking for. If anything, the lower back should flatten a bit into the bed. Feeling it pulling down into the pelvic floor in around 360 from belly button to spine.